my name is Dr. Ricardo Mejia of Jupiter Dermatology and Hair Restoration. The question for today is, what is a dysplastic nevi? A dysplastic nevi is basically an irregular mole. We all have many different types of moles on our body, and many times dermatologists biopsy these moles that look a little bit abnormal and have a different shape or different configuration. And primarily we're looking for the rules of melanoma, or the ABCDs, a mole that is asymmetrical, the borders are irregular, the color is irregular, the diameter is usually greater than 6 millimeters, or a mole that is evolving or changing. When dermatologists spot these moles, they typically recommend a biopsy. And many times that biopsy will come back as a dysplastic nevi of mild, moderate, or severe atypia. Now what does that mean, and why do dermatologists recommend removing them? Well, first of all, if you take a look at skin in general, and you have the epidermis, you have these melanocytes that are in the epidermis. And these melanocytes can give rise to melanoma. And melanomas are very bad skin cancers, the worst of all skin cancers, and they can spread all over your body. Consequently, we want to avoid them. A dysplastic nevi arises from the same types of cells, melanocytes, that look irregular under the microscope. And consequently, we want to reduce the risk of this becoming a melanoma. Now, dysplastic nevi is not a cancer, it's not a melanoma. However, in many studies that have been done looking at the risk factors for development of melanoma, it has been found that a dysplastic nevi does carry a 16% risk of potentially developing into a melanoma. Consequently, we typically recommend excising it or removing any residual margins or cells that are still attached to the skin to reduce the risk of any melanoma. Now, microscopically, as I mentioned, these cells look slightly abnormal. And just because there's an increased risk doesn't necessarily mean that you're going to develop a melanoma, but the standard of care is to excise these lesions in Florida and to reduce the risk of it becoming a melanoma. Now, in many cases, when you look under the microscope, if a mole is mildly atypical, sometimes that's a fairly good sign. In many cases, a severe atypia means severe irregularity, or the cells look very abnormal under the microscope, then that starts looking a little bit more like a melanoma and should, in many cases, be excised with several margins around the biopsy site. So, in answer, a dysplastic nevi is an abnormal mole that is irregular, that should be properly excised to reduce the risk of melanoma. It is not a cancer, and it is not a melanoma, but the standard of care in Florida is to remove the moles surgically to reduce that risk. An analogy that I like to give to my patients is that it's like driving a car. In many cases, when you drive a car, you don't think you're going to get into a car accident. You're not going to die in a car accident, but there's always that possibility. And statistically, there's a risk that when you drive a car accident can happen and you can undergo a fatality. Well, similarly, as you drive faster, okay, or if you're drinking or texting, the risk of a fatality increases. That doesn't mean it's going to happen, but it does. And statistically, there's a higher risk of an injury occurring if you drive way beyond the speed limit, if you're drinking while you're driving, and or you're texting while you're driving. So to reduce the risk of fatality, typically we lower the speed limit, we don't text and drive, and we don't drink and drive. And consequently, our risk is reduced. And similarly, when we have a dysplastic nevi, doesn't mean an injury or a melanoma is going to happen, but the standard of care is to excise it to reduce the risk of a melanoma. So with that, hopefully that's giving you a good explanation of a dysplastic nevi. Thank you very much.